Bine v-am regăsit, doamnelor, domnilor, aici la Sănătatea fără frontiere, așa cum v-am obișnuit săptămânal alături de noi medici de top din Turcia. Astăzi, alături de mine, prin intermediul StreamYard, se află doamna doctor Didem Can Trabulus. Domnia sa este medic chirurg, specialist pe ceea ce înseamnă cancerul mamar. Hello, doctor, can you hear me?
Yes, good afternoon.
Hello, nice to talk to you. Nice to see you.
Thank you.
Doctor, we'll start our interview, and my first question, because you are a general surgeon and breast surgeon, is what are the risk factors for breast cancer?
Let me tell you the incidence of breast cancer first.
Yes, of course, please.
As we know, breast cancer is one of the leading health problems all over the world. And it constitutes 30% of all female cancers. And it is the second most common cause of death from the cancer in women after the lung cancer. And when we think about age between 40 and 50 age, the women most common cause of death is breast cancer. And the chance of having a cancer is 1 in 8 women in the lifetime period. So, and the risk factors.
1 of 8 women
will get
breast
cancer in her lifetime. Yes. Unfortunately, yes. It's a very common cancer, and the most common cancer among the females, and that's why it's an important. That's why it matters. Okay.
Yes, I understand. So, please, doctor, tell me what are the symptoms of breast cancer?
Yes. And let me tell you the risk factors first. Being a woman is approximately a risk factor, but that doesn't mean that breast cancer is not seen in men. One among 100 breast cancers is a man. I mean, one is a man, and 99 breast cancers are women. And being in white race is also a risk factor. And to be over 50 years old is also a risk factor. And to have a breast cancer in the previous time is also a big risk factor for the second breast cancer. And breastfeeding is a protective event for having breast cancer. That's why we always advise our patients to have a baby, to get pregnant, and to breastfeed. And we say, especially to the patients, that you have to the woman, not the patients, but to the woman, to breastfeed, especially 6 months for the baby and 2 years for yourself. Breastfeeding is very important. And also the genetic mutations is also a risk factor. As we all know, there is 2 genes responsible for the breast cancer. These are BRCA, BRCA1 and 2 genes. If a woman has a mutation about these genes, that means she will get, or she will develop a breast cancer in her lifetime. The percentage is about 95 to 99%. That's why we recommend them to have prophylactic mastectomies, not to get a breast cancer. And the common and whole world know this. Angelina Jolie had a prophylactic mastectomy because she had this BRCA gen mutation. The previously exposure of a radiation is also a risk factor for breast cancer. If a woman or a man had a radiation because of, for example, this neck lymphoma, she can get breast cancer about 10 years later. And these are the risk factors that we cannot change, but there are some also risk factors that we can modify. For example, hormone replacement therapy or usage of oral contraceptives is also a risk factor to have these. And alcohol intake and being overweight and doing not exercises is also a risk factor for breast cancer. And
okay,
the symptoms.
You mentioned three important things. You said first that the woman who gives birth to a child is recommended to feed the baby to prevent breast cancer.
Yes.
The second aspect is that 1% of men can develop breast cancer.
Yes. I mean,
and the third one, that the genetic factor is very important when we talk about breast cancer.
Yes.
And I'll ask my colleague
right.
to show us some images with what breast cancer means.
Yes.
Sincerely, doctor, I didn't know that men can develop breast cancer.
Yes, I mean,
1%.
Yeah, among 100 breast cancers, one is man. 99 is women, but one is man. Let me show you the anatomy of the breast here to understand where the cancer comes from. Breast cancer comes from this breast ducts, that milk ducts, and milk producing lobules, as you see here.
Yes, we'll stop our images to show yours, doctor.
Okay.
Okay, I'm listening.
And the signs are especially, and people, I mean, women has to be aware of the signs also, because to come to the doctor, of course. For example, breast cancer may be asymptomatic. I mean, that's it can be detected by screening mammograms, or symptomatic, like she can have a palpable mass on in her breast or axillary arm tip, and she can have some nipple discharge, especially hemorrhagic nipple discharge is very important. When they see a blood on their bra, they have to be alarmed, and they have to come to check their breasts. And also nipple inversion is also important. That means there's something pulling the nipple inside. And ulcerations, edema, and a kind of orange peel appearance, we say it peu d'orange, is also an important, it's the sign of an inflammatory breast cancer. And also there can be some lymph node enlargements, especially in axillary region, or which we say supraclavicular region here, is also an important signs and symptoms of breast cancer.
So you anticipated my next question, doctor. What are the symptoms of breast cancer? You just explained.
Yes. Yes.
Okay.
If we can show the some images here.
Yes,
for example, there is an image with 4 pictures. I can show.
I'll ask my colleague
to
show us the images.
Yes, please.
Okay, we can see them.
For example, we can see a nipple discharge in the first image. If I can, you can go a little bit.
Okay, next one.
Next one, please.
Yes.
I think they
What
are
do we
not.
have here, doctor?
These are the lymphatics of breast. As we all know, breast cancer spreads to the axillary region first. That's why in the surgery we also go to axillary lymph nodes also. We have to take them, and not for all the patients, but some of the patients. We have to do surgery to axilla also.
Okay, next picture.
Next, please. Okay.
Here we have breast ultrasound.
No, not that one. This is the how we do the ultrasound. If we, I mean, these are the breast cancer staging system.
Please explain us, doctor.
Okay. I think what we do if we have a patient coming with these symptoms is what we do is we have some images. For example, these are especially mammography. Mammography is also very important. Mammogram and ultrasound and MRI also we do to find out to identify the mass, if it is malignant or not. Mammography is also very important. We do it especially for screening screening mammography. In Turkey, we start at 40 age, but in Europe and in USA, they start at 50. Why we start in 40 is because in our country we have too many breast cancer patients between 40 and 50 age. That's why we start at 40. Screening mammography is very important, and we have to inform the women that yes, they are getting radiation, but the advantage, I mean, the pros are more than cons with doing screening mammography, because you can diagnose breast cancer in stage 1. That's why.
Okay, doctor, please tell me, when do you have to do this screening mammography? After 40 years old or 50, as you said?
Yes, I mean, in our country we start at 40, but
Yes.
in Europe and in USA they start with they start from 50 years old. We start earlier because we have young age breast cancers too much, you know. Between 40 and 50 we have too many breast cancers. That's why.
When do you have to do this checkup?
When?
Yes.
Yes.
To prevent
every year,
breast cancer.
annually, we do mammograms annually. Even they don't have any symptoms, they have to come. And we do it annually till 70 years old. After 70, we do once in 2 years.
I understand. How is breast cancer diagnosed,
And before 40, the preferred image is ultrasound. We do ultrasound before 40. Okay.
I understand.
Yeah,
Doctor, please tell me, how is breast cancer diagnosed?
Yes, the breast cancer for the diagnosis of breast cancer, we use these imaging techniques that I told you before: the mammogram, ultrasound, and MRI. We can have MRI also for the patients who are young, and mammography cannot show the whole breast because of the intensity of the breast. That's why we can prefer MRI also. We can add MRI to the basic imaging techniques. And the exact diagnosis is done with core biopsies. We have to have not a fine needle biopsy, but a core biopsy to be sure that the type of the breast cancer. That's why we use a special device for it. It's like it cuts a tissue, and I mean it takes a part of the tissue. That's why with a fine needle biopsy, I mean with a shrink, we just have only cells, but that is not enough for us. We have to have a tissue sample. That's why we do core biopsies. And after the diagnosis of the breast cancer, we categorize it to manage the treatment.
I understand. How is exactly breast cancer treated? And please tell me, doctor, when it's too late.
Yes, yes, that's a good question. We want to, our wish is to diagnose it in the stage one breast cancer, in the stage of 1, because if a patient has stage 1 breast cancer, maybe she will not need a chemotherapy. That's why screening mammography is very important, because if the symptoms come, that's if we diagnose it in stage 2 or stage 3, it's okay. It's also a we have therapies for it. But stage 4 means it's metastatic disease. That means breast cancer spread to everywhere, every vital organ. These are brain, lung, liver, and bone. That is, and the survival is very low in this stage. That's why we wish to diagnose it in stage 1. That's why
1, 2,
only
3?
Surgery and radiation therapy will be. Yes.
So stage
only
1,
surgery
2,
and radiation
3
therapy
are okay. Stage 4 equals
okay,
what?
but 4 is metastatic disease.
Okay, tell me, doctor, please, what are the innovations in breast cancer surgery?
And the nowadays, and also we have new breast surgery techniques. For example, in the previous years, 20 or 30 years ago, all women who has breast cancer has to have mastectomies, but not now. We don't do it, especially after the operation of Angelina Jolie, and she had BRCA1/2 mutation. That's why she had her breasts emptied, and with implant reconstruction, she had breast now. Without tissue, but with implants. And that's why the technique we call is nipple areola complex sparing mastectomy. Is also a surgical technique. It's an alternative for radical traditional mastectomy. What we do in nipple sparing mastectomy is removing the breast tissue without removing the skin and without removing the nipple areolar complex, and filling the skin envelope with a silicone implant. After the operation, nobody can say that she doesn't have breasts. And it's also she will feel better, because she goes out from ORE with her breasts also. Yes.
Doctor, please tell me, why do you think that breast cancer is on the second place after lung cancer when we talk about mortality?
Yes. The thing is innovations, innovations in chemotherapeutics and the awareness also that we have also give to the patients and to the women. And the screening programs is very popular now. That's why we diagnose breast cancer early, in early age. That's why it is not a mortal cancer now. That's why we turn to aesthetic surgeries in breast cancer surgery. We combined it, aesthetic surgery and breast cancer surgery, because women with breast cancer are living longer, and they have to be comfortable, and you have to provide them life comfort also. That's why the surgery technique we combine with aesthetic and oncologic surgery is oncoplastic surgery. Now we use oncoplastic techniques to shape the breast and to do the breast symmetrically. We don't do mastectomies, traditional mastectomies. Alternatively, we empty the breast, and with silicone implants, we fulfill the breast with silicone implants.
Okay, and my last question, doctor, what's your advice for the women who have symptoms of breast cancer? I want to say some message to take it home, because early diagnosis saves lives. That's why do not neglect your annual screening mammograms, and do not neglect your annual doctor checkups, and don't forget to check yourself monthly. And Monthly, you said.
yes, monthly. Every woman after 20 years old have to do self-examination, self-breast examination. That means they can be aware of her breast, and they can get their I mean, if she has a symptom, or if she has a lump, or if she has a nipple discharge, she can be aware of it, and she can come earlier to the doctor to have, if she has breast cancer.
Thank you very much,
We advise
Doctor.
self-examination, especially.
Okay, thank you very much, Doctor, for all these informations.
I thank you. Nice to meet you.
Same here. Have a nice day.
Thank you.
Hope to talk to you soon again.
I would like to. Thank you. See
Okay.
you. Bye bye. Have a nice
Bye
day.
bye. You too. Doamnelor, domnilor, a fost așadar doamna doctor Didem Can Trabulus, medic chirurg, specialist pe ceea ce înseamnă cancerul mamar, o serie de informații prețioase pe care doamna doctor ni le-a furnizat astăzi. Eu vă doresc în continuare o zi plăcută, toate cele bune, la revedere, ne revedem data viitoare cu un alt medic de top.